Hi, everyone. It's Kim Williams, Chief Executive, and gosh, it is August already. So, this is Core Leader Briefing. Just a couple of updates. And first, I want to thank all of you. You have done incredible work helping us get to budget in the month of June, which is really remarkable. So much hard work, and I so very much appreciate it. And many of you have had a furlough week, and I know that that has been a hardship. And again, I want to express my sincere gratitude for that. And I know that that has contributed greatly to our success in hitting budget. So, a reminder that the summer meal's coming up. If you haven't signed up to help distribute the lunches, dinners, and midnight food, please do so. This is a great opportunity to see staff, connect with staff, and to thank them for their great work. One of the things, we're doing a monthly survey on what's kind of going on with our caregivers that may have accountabilities for caring for patients with coronavirus. And one of the things I continue to see in the responses is we'd feel so much better if we could wear an N95. I just want to make sure you all know that if in fact you have a caregiver who would like to wear an N95, that they need to get tested, fit tested, and then they certainly may access an N95. So this is not a restricted use item any longer if in fact they would be more comfortable. So please, please, if you hear that from your caregivers, help us get that word out, because I see it every single survey. The other thing I want you to know that we're working on is we're looking at some different goggle types for individuals who need eye protection, and that they wear glasses, and when they wear the mask and the shield and the glasses, they cannot figure out how to not have everything fog up. So we're working on that. Don't have an answer for that yet, but we are working on it. If you are an individual that is LAIP eligible, please make sure you have gone in and updated the status of where you are with those goals. That needs to be done this month. And, we have our caregiver engagement survey coming up, and having those mid-year conversations with your caregivers, please, please spend some time rounding, meeting with folks, and really connecting with them, because that is what is so important to individuals, is to be seen as an individual by their leader. So please do so. Very excited. The mental health unit is really starting to move along. You will see that the 3A patients and staff will be moving to 6A this week. And that is really a sign of progress. The reason we're vacating 3A is because the construction will be on 4A, and it may be disruptive. We will continue to have patients on 3A, but that will be more of the overflow unit, as 6A has been historically. I will also just share with you that caregiver health, when they are recommending that a caregiver be off work for 10 days or 14 days, based either on symptoms that and maybe a negative COVID test, but still they have some illness that they need to be off for 10 days. The question about whether they are a critical staff member or position will now be escalated to the administrator on call to make that determination. It doesn't mean they'll make it without checking with you, but you do need to understand that that will no longer be a unit-based decision. And this is something we are doing throughout the Washington, Montana region. And I personally am very supportive of it. I know that being off work is a hardship for units. I also know it's a hardship on our individual caregivers, but I also know we have had some significant lapses where caregivers maybe shouldn't have been in the workplace, and they were, and then we've had exposures. We've also had some procedural lapses where caregivers have been exposed to patients. And so we're doing some retraining, But one of the other interventions we will be making is that this question about whether it's critical staffing will be escalated to the administrator on call. Visitation continues to be a concern, and I know your patients, particularly in med-surg, are really suffering from loneliness and missing their families. So please help them connect via FaceTime, and please help us get that word out that masking is what is going to be. It's the one thing every citizen can do to slow down this spread, minimize the disease burden, and get us to a point where we can have visitors in the hospital. So please help us with that message, because it is going to require each and every person. And I will tell you, I have received complaints from the community on two different topics. One is seeing Facebook posts of leaders not social distancing, not wearing masks, doing things that they hear health experts say is not in the best interests of public health. And the other thing is posts from caregivers that are racist. And so no big surprise, I have no control over what any of you or your staff do on their off time. But please just think about the messages that are being delivered. And I think that is all. Oh, one last thing. And then I know I've gone over my time, so apologies. I want to remind all of you, take time. Take your weekends. If you see your leader sending you an email on the weekend, you do not need to reply. If you see something from me, you do not need to reply. If we need you urgently for something, we will text you, we will call you. And I have no expectation that anybody is doing emails on the weekends or in your evenings. I want you to be refreshed and to feel good about coming to work. So I appreciate you. Have a great August. Hopefully we will have beautiful weather. Thanks, everybody.